Good morning, good day, and good evening to this second day of the conference, the International Conference on Big Data. My name is Rikke Hansen. I work at the Regional Commission for Asia and the Pacific, ESCAP, and it is my pleasure to facilitate this fourth session of the conference. The session is on achieving the Sustainable Development Goals in a time of COVID-19. Now, at the first day of the conference, we heard policy perspectives and the role of the statistics community on responding to COVID-19. We also heard on the use of big data for sustainable development goals and the use of big data for the COVID-19 response. And this session is going to bring all these parts together to talk about achieving the Sustainable Development Goals in a time of COVID-19. And with me, I have 5 distinguished expert speakers. 2 of them will speak from the global perspective on the topic of the session, and 3 will speak from the national perspective. The session will have 2 parts. The first part will be hearing from people working at the global level. After that first part, we will take some questions from the audience. And then the second part, we will hear from our 3 speakers that focus on national initiatives and experiences. We will take questions for each of these speakers, and then hopefully at the end, we'll have some time for a general question and answer session. And to all of you listening into this session, I do encourage you to use the live stream to send in your questions so that we can have some two-way communication even in this very virtual era of our collaboration. Without further ado, I would like to introduce our first speaker. Her name is Yongyi Min. And Yongyi is the chief of the Sustainable Development Goal Monitoring Section at the United Nations Department of Economic and Social Affairs Statistics Division, also known as UNSD, one of the co-organizers of this conference. Yongyi Min, in her work in the Statistics Division, supports the Interagency and Expert Group on Sustainable Development Goal Indicators, the IAG SDGs. Yongyi Min is also the lead author of the annual Global Sustainable Development Goal Report, and also a number of other SDG products coming out from the Statistics Division in New York. Earlier, Yongyi has been responsible for the global monitoring of the Millennium Development Goals, the predecessor to the SDGs, and she's also been involved in gender and environment statistics. Yongyi holds a PhD in statistics from the University of Florida. Yongyi, you have the floor, please.
Thank you very much, Gemma, Ricky. Good morning and good evening, and dear colleagues. Let me share my screen of my presentation. I would like to thank you, the conference organizers, for inviting me to share some key findings from the Sustainable Development Goals Report 2020. The SDG Report 2020 was launched in July at the high-level political forum, which used the latest available data and estimates to track progress towards the SDG before the pandemic started, but it also looked at some of the devastating initial impacts of COVID on specific goals and targets. We're now 1/3 of the way into our goal to meet the SDG by 2030. This report shows that even before the pandemic, the world was not on track to meet the goals. And COVID is having a catastrophic impact on efforts to achieve the SDGs. the pandemic has disrupted implementation efforts for many of the SDGs, and in some cases is threatening to turn back the progress that many have worked hard to achieve. The COVID could push millions into hunger and extreme poverty. Before the COVID, the pace of global poverty reduction was decelerating, and the global goal of ending poverty by 2030 will be missed. The poverty rate is projected at 6% in 2030. The COVID is projected pushing an estimated 71 million of people back into extreme poverty and causing the first increase in global poverty in more than 20 years. The number of persons suffering from hunger and food insecurity was on the rise before the pandemic. Almost 690 million people were undernourished in 2019, up by nearly 60 million from 2014. About 2 billion people were affected by moderate or severe food insecurity in 2019. The pandemic may cause additional 132 million people to suffer from undernourishment in 2020. So along with conflict, climate shocks, and the locust crisis, the pandemic posed an additional threat to food system affecting the most vulnerable population. Health and education outcome are adversely affected. Progress in many health areas, such as improving maternal and child health, in increasing coverage immunization, and in reducing some infectious disease continues. But the rate of improvement has slowed down before the pandemic. COVID is overwhelming health system globally. So the disrupted health services and life-saving intervention will cause hundreds of thousands additional under 5 deaths, and a spike in illness and deaths from communicable and non-communicable diseases. For example, 70 countries report moderate to severe disruption or total suspension of childhood vaccination service during March and April 2020. Progress towards inclusive and equitable quality education was too slow. It was estimated over 200 million children will still be out of school in 2030. School closure because of the COVID-19 affected over 90% of the world's student population. Disrupt education is adversely affect learning outcome and social behavior development children and youth. So for on Goal 5, the commitment to advancing gender equality has brought about improvements in some areas, such as fewer girls forced into early marriage and more women in leadership roles, but full gender equality remains unfulfilled. The pandemic is hitting women and girls hard. Domestic violence against women and children is rising in many countries. In some countries, cases of domestic violence have increased by 30%. Globally, in 2017, 2.2 billion people lacked safely managed drinking water services, and 4.2 billion lacked safely managed sanitation, and 3 billion people lacked soap and water at home. So water, sanitation, and hand washing facilities are critical to prevent COVID spreading, yet 40% of health care facilities were still not equipped to practice hand hygiene. The pandemic is pushing the world into the worst economic crisis since the Great Depression. So we can expect the biggest increase in global unemployment since the World War II. The COVID could cause the equivalent of 400 million job losses in second quarter of 2020. And the aviation and tourism industry will likely suffer the steepest decline in their histories. The global recession could constrict aid flow to developing countries, and the remittances to low and middle income countries are projected to fall by 20%. The COVID is hitting the poorest and most vulnerable people hardest. The crisis has significantly affected the livelihood of 1.6 billion of informal sector workers, which is half of the global workforce. As the school close and more families fall into extreme poverty, children in poor and disadvantaged communities are at much greater risk of child labor, child marriage, and child trafficking. So in fact, the global gains in reducing child labor are likely to be reversed for the first time in 20 years. So in short, the crisis may have life-altering consequences for millions of children and youth worldwide. So climate change is happening much more quickly than anticipated. The year 2019 was the second warmest on record. The global temperature are on track to rise as much as 3.2 degree by the end of the century. To meet the 1.5 degree target called for in the Paris Agreement, greenhouse gas emission must begin falling by 7.6% each year starting in 2020. However, despite the drastic reduction in human activity due to the COVID, the resulting 6% drop in emission projected for 2020 falls short of this target. And the emissions are expected to rise as restrictions are lifted. The world continues on the path of using natural resources unsustainably, and ocean acidification threatens the marine environment and ecosystem services. So by the end of 2020, 21 of the 169 targets will mature, of which 12 are linked to the UN and biodiversity targets. Despite some progress, the world is falling short on 2020 targets to halt biodiversity loss. So the pandemic has shown us that getting the data can guide the policy response to the crisis at every step, from response to recovery, with life and death implications. However, in many countries, even the most basic health, social, and economic data are often absent. In addition, the most vulnerable population who need help the most remain invisible. Analysis of data availability of global SDG indicators reveals that for 4 of the 17 goals, less than half of the country have internationally comparable data. This lack of country level data is particularly worrisome for Goal 5 on gender equality, where on average only about 4 in 10 countries have data available. What's more, even countries with available data have only a small number of observations over time, making it difficult for policymakers make it possible to monitor progress and identify trends. In addition, a large number of SDG indicators are available only with a significant time lag. For instance, in at least half of the country or area in the database, the latest data point available for poverty-related indicator Goal 1 is for 2016 or early. Among increasing recognition of the importance of data, the crisis is disrupting routine operations throughout the global statistical data system. UN Statistical Division and the World Bank, in collaboration with the UN Regional Commission, conducted 2 rounds of global survey to monitor the impact of the COVID crisis on national statistical offices. First in May 2020 and the second in July 2020, with over 100 national statistical office replies. The responses collected shows that the statistical agency in the low and middle income country face the highest level of disruption to their operation, and 2/3 have the greatest needs in terms of technical assistance and financial resources. So therefore, immediate financial and technical support for national statistical system is urgently needed over the short term to ensure continuation of statistical operation for COVID response effort and the recovery strategy, and in the medium and long term, mobilization of international and domestic resources to increase investment in national data and the system will be imperative if we were to build back better from the crisis and to accelerate the implementation of the SDGs. So new partnership to increase the use of new data sources and the technologies with NSOs at the center will need to be forged, including between public producer of data and private sector, academia, and other parts of civil society. Use of big data techniques and the integration of geospatial information and the statistical data will be particularly important. The time is now to invest in data and innovations to respond to the crisis and support SDG acceleration. So for more information, and you can visit the full report and the database from our website. So I'll stop here. Thank you very much.
Thank you very much, Yongyi, for painting a rather bleak picture, but also to come with some very strong recommendations. As mentioned, we will move on directly to our next speaker, but just before I introduce him, I just want to again strongly encourage our viewers to send in their questions using the Q&A live stream for the conference. So let me move on to introducing the next speaker, Mr. Luis Gonzalez Morales. Luis is a colleague of Yongyi at DESA Statistics Division. Luis is the chief of the web development and data visualization section at the Statistics Division in New York. There, Luis co-leads initiatives on open data, data interoperability, integration of geospatial information and statistics for the Sustainable Development Goals, and much, much more. During his now 15 years with the Statistics Division, he's been involved in quite a number of capacity development projects with statistical offices from all over the world. Those projects have been in the areas of economic statistics, data quality, and the last couple of years related to the Sustainable Development Goals, coordination, as well as statistical activities and indicators in particular. So, Luis, please, you have the floor.
Thank you very much, Rike, for this very kind introduction, and thank you also to the organizers of the conference for this opportunity to speak to this audience. Let me start sharing my screen, and I hope you can see it now. I want to complement the picture that Yongyi presented about the work at the global level on SDG monitoring and now the impact on the COVID-19 crisis, with what we have been doing to support member states and their partners in making the data that is needed to address the COVID-19 pandemic and the impact it is having on the attaining of the SDGs, to make this data available and accessible to policymakers so they can take corrective actions. So, see. Here I want to stress what has been already mentioned, the important role of the national statistical systems and the geospatial community in leading this response, making sure that the response to the crisis is drawing from the entire national statistical system and this national spatial data infrastructure, different data sources available from multiple institutions, from multiple stakeholder groups involving all relevant ministries and government agencies. So this is part of the work that we try to promote, to make sure that the national statistical systems are at the center, leading the way. And for that, we are facing, countries are facing a lot of challenges related to interoperability and open data when we try to integrate data coming from different institutions that has been collected and compiled for different purposes originally. It is difficult to share those data and to integrate them and work with them. So there are different needs and different capabilities and disparate protocols, technologies. The data production systems are often siloed, fragmented, and also the dissemination systems. So many national statistical organizations are now working hard to adopt and enforce the adoption of open data policies that facilitate the use and reuse of data that is already existing in some shape and form, but not necessarily used to their fullest extent. And so these open data policies require the data also to be at the technical level interoperable, and beyond the technical interoperability, at the governance infrastructure, the coordination mechanisms need to be in place. So the systems, data systems that we face today are highly decentralized. There is no single integrated database containing all the information that is needed, both to implement the 2030 agenda, but also to address a challenge as complex as the COVID-19 pandemic. We are faced with multiple data sets being stored in different places, and for the most part in different platforms that have been developed independently from each other. So this is a challenge for data innovation that is collaborative and that brings ideas contributed from many independent partners. And that is part of what we are trying to address with at the global level, but also more importantly at the national level. The vision is of being able to integrate the statistical and geospatial information systems and to make this data that comes from those systems open, accessible, and used to the fullest extent possible. The vision is to build a network of what we call COVID-19 data hubs, using web technologies, open standards, supporting the engagement with partners, and the development and proliferation of data initiatives that can be brought together in a participatory and enabling environment. In this context, what we at the Statistics Division of the Department of Economic and Social Affairs are doing, we are partnering with technology providers and very particularly with ESRI to launch an initiative to provide access to countries for software and tools to join a federated network of COVID-19 data hubs. This initiative leverages WebGIS technologies for sharing available data and resources, and in an open and interoperable environment, and also providing ready-to-use templates to national statistical offices so that they can quickly get to their work in making datasets available, focusing on responding to the needs of users rather than having to spend a lot of time in designing the user interfaces and the configuration of different systems. So why a federated network? So to respond to the needs of policymakers and through the dissemination and use of integrated statistical and geospatial data. So there is a lot of data already available, but one of the biggest challenges is to connect them and to make them easily accessible to policymakers, to analysts in a interoperable type of platform. Since I don't have much time, but I would like to invite you to look at the details of this initiative at the end of my presentation. There is the link. One thing I would like to mention is that this initiative on COVID-19 data hubs builds on the work that we have been doing already for the last 4 years around the development of a UNSD data hub and a federated information system for the SDGs. So different countries have been already trying this technology, and those that that had already this experience could very easily start setting up their own COVID-19 data hosts. So we have the examples like Ghana, Palestine, Jordan, where they have been able to very quickly develop their COVID-19 data hubs because of the experience, the know-how that they have been developing and accumulating over the last 3 or 4 years. The Statistics Division is partnering with regional commissions, with other stakeholder groups in order to bring the capacity building activities to the countries to strengthen their ability to benefit from this type of infrastructure and platforms. So we have a training program for member states that join this initiative, where we go through the full life cycle process from assessing the data needs, defining the workflows to bring all those data together, going through the technology aspect and the tools that need to be in place, then modeling the data, conditioning them with the necessary georeferencing, so as to finally put them out in web applications, maps, visualizations that convey the data in an actionable manner to policymakers and to users at large. So this is a complete approach that goes from the assessment of the needs of the policymakers to the development of data dissemination products that aim to address those needs. As an example, we have the COVID-19 Data Hub at the UN that provides links to relevant resources about how to ensure continuity in statistical systems, best practices, lessons learned, open data resources, and some dashboards and visualizations. And more importantly, this is a place where countries are able to showcase their work, their dashboards, their visualizations, their data, the data assets that they are able to share. This is another snapshot of that COVID-19 Data Hub. And with that, I would like to stop and conscious of the time, but happy to respond to any questions after right now or after this session. Thank you very much, and over to you.
Good. Thank you very much, Luis, for an interesting presentation with lots of good advice and places to start also for anyone who wants to get engaged. I will encourage our viewers of this session to have a look at the United Nations SDG Data Hub. There is a lot of very interesting information there. So thank you again, Luis. We have received a few questions from the audience, and the first one comes from the head of the Statistical Training Center in the Republic of Korea, and this question is mainly to you, Yongyi. The question is as follows. Now, if you need to produce SDG indicators in a very hurried way to be able to say something about the COVID-19 impact, as what we saw from your presentation, how do you ensure the statistical quality of the indicators when very high frequent information and updates are necessary? Please, Yongyi.
Yeah, thank you very much for the questions. And for this round, we actually faced a lot of challenging in providing the latest data related to COVID. And basically, we rely on most of the estimate related to COVID impact at a global level. It's mainly from the international agencies. For example, that we keep updating the unemployment figure from ILO, and we updated the figure for 3 times in the period 3 months of preparing this report. And And for others, similar procedures, because it is very difficult, challenging to get very detailed country or even regional data. So the only data available is mainly at the global level. For example, some agency has a more updated data, like UNIDO on industry production, ICO on the aviation, and all this data we can get. But a lot of the other COVID impact is actually a projection and estimation. So there's a lot of assumptions and made. So many of the projection has a big range. It's a range of estimation. It's not an accurate estimate. So given a different scenario, and they provide different estimations. Thank you.
Thank you very much, Yongyi. And I think we all got a bit of an insight in the complexity here, but also information about the numerous agencies and experts actually involved in producing these various estimates. And this is, so we rely on good data from national statistical systems, good data reporting, and afterwards processing and quality assurance, not only in the statistics division in New York, but also by the many United Nations specialized agencies that are the custodians of the global indicators. So thank you very much, Yongyi. I will move to a question to you, Louise. This is from Sung Jong, and he's currently involved in a big data project in Laos. And his question, which probably is something that will relate very much also to your experience in capacity development projects. His question is, when it comes to big data, how and where do we begin in very concrete steps? If we look particularly to the least developed countries where there are no data, the data doesn't exist, the institutions are weak, etc. And Sung Jong is asking for some practical guidance. Please, Louise.
Yeah, well, I mean, my question is my response is twofold. I think where we should always start is by understanding very clearly what are the user needs, the policy needs. So often I think we err on by taking big data methods, big data sources, and trying to apply them to whatever problem without regards of whether they are actually fit for purpose. So instead of starting with a method and then trying to find a problem for that method, it's first understand the problem. When we start working with experimental new methodologies, new data sources, with big data techniques and so on, we can start small, start with simple exercises. And one of the main challenges that we will find is to make those experimental exercises become mainstream. So we need to have a clear idea of how the data is being integrated and how these workflows fit into the capabilities that we have in our institutions, the technology that our staff is familiar with. So try to find those methods and those techniques that will be able to be sustained over time. So this is sort of a very vague answer, but I think there's some truth to it, that the methods need to be, even for innovation, they need to be attuned to the skills and the level of technology that we have, the level of maturity that we have. We can start small with simple exercises that deliver a lot of value, instead of trying to go for the big complex systems that will come later when organizations mature.
Thank you very much, Louise. So small steps and keep policy demand in mind. to focus the efforts. Thank you very much for this advice. There's one more question to you, Louise, and there's also one more question to you, Yongyi, and then after you both have spoken to the next question, we will move on to part B of our session. So Louise, the second question to you is from Alexandre Barbosa. He's the head of studies for information and communications technology in Brazil. And he's asking, well, attractive or comprehensive data visualization requires multiple data sources and actors. How can you guarantee data interoperability considering that data sources are fragmented or not open? Can you keep your answer to 1 minute, please?
Yes, so data interoperability, that's the big question, and it goes in different levels. At the level of definitions, making sure that we are using the harmonized classifications and so on, the same semantics of our data. Also the technology protocols, the governance for accessing the data. So there are many aspects to that interoperability, all of them very, very important. We cannot have interoperability only through technology, but also not only through governance. We need all of those pieces together. So if I may just make a little bit of an advertisement, we have an interoperability guide that has been presented at Statistical Commission in the last few sessions. So there is work on data interoperability going on that can inform and can provide some guidance on that. And I would be happy to provide references on that. Thank you.
Thank you very much, Louise. And you may want to share the link through the live stream Q&A so our participants can immediately click their way to more information. Thank you. Now, Yongyi, the second question to you is actually a follow-up to the first question. And this question is posed by Ronald Jansen, who you know very well. He's one of your colleagues. His question to you is, well, are the custodian agencies actually increasing the frequency of collecting, estimating, disseminating the SDG indicators because of the COVID-19 pandemic or in response to that? Also, 1 minute to you, please.
Yeah, we see, I think I didn't present in my presentation. According to the survey in the country, a lot of face-to-face data collection actually got disrupted. And I think in May, when we surveyed, like majority of the survey got disrupted. So agencies actually use an alternative method, a lot of them. So this is where the innovation came. Then they rely on estimation and forecasting, nowcasting techniques. So this is the combination of the different resources and can produce this estimation. But on the other hand, this is not so reliable because there's a lot of assumption. So the custodian agency also did a lot of the re-estimation, justification for the estimation. I think some agencies do this estimation every quarterly, monthly. Some are very, very frequently. It depends on the area of the work, how much they have impacted by the pandemic. Thank you.
Okay, thank you very much, Yongyi, and thanks both to you and to Louise for your excellent presentations. Thanks to the audience for their questions so far. We will now move on to the second part of this session, number 4. So we move now from the global perspective to a national perspective, and we have 3 speakers in this part. And I will open up for 1 question or so after each speaker. So let me invite and introduce our next expert speaker of this session. His name is Ramiz Uddin. Ramiz is the head of results management and data at the Aspire to Innovate program. It's a joint program of the ICT division and the United Nations Development Program, UNDP, in Bangladesh, where Ramiz is also based. So in this position, Ramiz coordinates SDG-related activities with national partners. He facilitates data innovation initiatives to strengthen a culture of evidence-based policy decisions in government, something many of us are asking for. And Ramiz also played a pivotal role in drafting the National Sustainable Development Goal M&E framework of Bangladesh. And Ramiz holds a master in psychology and a PhD in social psychology. Ramiz, you have the floor, please.
Thank you so much, Ricky. So today I am going to share country case. In the meantime, Yongyi and also Luis created context to understand my slides, because it is only 10 minutes, and then I will share some practical experience from Bangladesh. Can you see my screen?
Yes, we can. Thank you.
Also, can you hear me?
We can hear you clearly.
Yeah. Very quickly, I will share some cases from Bangladesh. So that is how big data, especially the big data, contributing to achieve SDGs in this COVID perspective and also non-COVID perspective. If you look at several cases like data from digital device and also e-commerce site and NID, and also historical data for insight, and also telco data, and social media data, and advanced data analytics. All these features, I will share you some cases, how we are working with the government agencies, within the government agencies, and how we are facilitating policies across the SDG data and also the big data and also the partnership. I wanted to share one experience, that is first what we have to contribute to SDG 7. We have analyzed big data for electricity consumption and supply in Dhaka city for last 10 years. So that request came from Prime Minister's Office of Bangladesh for the Energy Advisor. So we are going to plan for next 10 years energy consumption. So an energy plan. So could you please provide with the big data analysis in Dhaka city and other peripheral areas, in the commercial area and also the residential area, what is the consumption, what is the supply? Could you please come up with some insights that can help in our planning? So we could analyze some of the very interesting findings. We found that, okay, in some of the areas, the consumption is alarming. In some of the areas, the supply is really alarming. So to manage all those, to accommodate all these findings to our next friend, we could contribute in a big data it is related to SDG 7. If I look at the COVID situation, and which is related to goal 3, so immediately we try to find out that what are the area to find the people and who are a bit has syndrome like COVID. So we had to take support from the different hotlines, that is different numbers, and also the call center, and also some USSD we had to provide. And based on those data, we tried to identify the areas where are the confirmed cases, where are the suspected cases, where are the high risk people. So to identify all these areas in different technology we had to use, using the call center data, use the geospatial data, and also it is not only the national, and we have to identify the areas at the district level, as well as sub-district level, at the micro level, because we had to provide support to the policymakers, we had to provide support to the civil servant at the even rural level. So that is why we came up with all types of collaboration with private sector, health sector, and also the non-health government sector to provide all these type of and analyze the data. But if we, what is the early aspect, how it is spreading, how it is moving. So we had to look at all this to support to national preparedness and response plan, we had to came up with some big data analysis, and also we had to merge lots of socioeconomic data and geospatial data with COVID data to help the policymakers how it is growing the hotspots, and at the same time how it's moving in different locations. So you have to came up with some kind of analysis at the sub-district level. If we look at this slide, you can see in the middle picture that is what is the sports, and at the same time to time we are also in the time trend analysis, we are looking at how the hotspots are going and how it is moving in different places. After 10 days, which will be the hotspots, and after 20 days, which will be the hotspots, and what is the movement pattern of the hotspots, and what should be the preparedness for the health sector in different location. That we had to provide those type of prediction and also prescription to the government agencies, including Cabinet Division, Prime Minister's Office, and also the National Task Force Committee. It was not only like that. Based on those data, actually we had to come up with some areas, like people are asking, is this hotspot area? Why you are saying like that? It is okay. Based on the data, we had to identify the red zone, we had to identify the yellow zone, and we had to identify the green zone. So we have to came up with that definition based on the data, and we identified those areas, and we applied some measures for those areas as well. So applying all those, you had to depend on a lot in the private sector data, because telcos provided lots of support in tracking, in managing, and also in planning. So that was a use. But again, when we are planning, identify the hot zone, again question came from the civil servant and different government offices that, okay, you have identified those areas, hotspot areas, and what about the details of the data? What is the specific building? What is the specific roads? What are the hot zone actually? But it is not only the hot zone, only one ward, only the small town, but you have to look at the roads, the building, where the patients are, and how they will move, how they will control. So we have to aim this type of detailed data using geospatial technology, and then we have provided that support. That was really, really useful, but we faced lots of challenges as well. If I come to the SDG tracker, so we have already learned, we inaugurated started this SDG tracker, SDG result tracker in Bangladesh in 2017. But in the meantime, we have also merged with the big data, introduced some big data technology with this SDG tracker. And it is possible in this COVID situation, we have learned a lot, what is possible, what is not possible. So about the privacy as well. So we are proceeding like that way, how come up with some very good visualization, which immediately can help for better decision making. But the ministry, you know that climate change disaster is a huge issue in Bangladesh, because what are our, the sea level in Bangladesh. That is why we came up with the goal 9, and also the contribute to the climate action. We had to came up with this idea like that. Okay, what will be the monitoring system, and also the big data approach, and for come up with some flood forecasting. So we work with Google. We are working now with Google as well, and came up with some idea with the geospatial data, and focus in some of the areas which districts are vulnerable in terms of project progress, and in terms of vulnerability. What is the vulnerability index? So we are developing that, what in the process now, and at the same time providing support with this type of technology, and also the mobile apps as well based on this platform. So use issue, this is DRR, and also the climate change in Bangladesh. We had to came up with this type of technology. There is a dengue management in Bangladesh. It is South Asia, it is hotspot. and also we have 20 years data. We merged with the environment data for last 10 years, temperature data, rainfall data, and also came up with the humidity data. And at the same time, the wind speed, we had to merge with this technology that is to came up with a prediction model. And hotspot areas, with 13 hotspot areas you have identified, we are providing support to the government agencies. Okay, what will be the responsibility for the city corporation, for the DG health, and also for the community. And based on that prediction model, we are also sending SMS to the citizen to take care of their area, how to do that. But at the same time, in the SDG data.
Mr. Ramiz, can I please ask you to wrap up? Thank you.
So these are the area technology we had to use in COVID period. And also it is not like that. And you had to came up with some idea that what is the impact of COVID in the non-health area, in the education with this technology. It was easier to came up with lots of that. And also what is the impact of COVID in the employment. We have developed that technology in Bangladesh. But Luis already identified some of the area. But these are the we learned that we should be the next step. We have to learn with the UNSD. We are going to work together. We have to learn that is the data sharing policy. That is, we need the very detailed data integration, data privacy, and partnership. Thank you so much for your questions. Thank you.
Thank you. Thank you very much, Ramiz, for a very interesting presentation. I think we see the importance and power of a request from a prime minister that gives a lot of impetus for a lot of work. And I also trust your presentation partly responded one of the questions we received in the first part of this session. Where do we actually start? In particular, in less and least developed countries. And what you've just shown us is that there is actually a lot that can be done. So thank you very much, Ramiz. We will move on to the next presenter because we have not received any questions at this point in time, but we may I may revert to you later on. Thank you again, Ramiz. It's now my pleasure to introduce the next presenter in this second session. It's second part of the session. We move from Bangladesh to Fiji, and it is my pleasure to introduce Ms. Litia Kurisaqila-Mate. Litia is the assistant statistician from the Fiji Bureau of Statistics. Litia focuses in that position on satellite accounts and on the implementation of the system of environmental economic accounting. And she has worked together with my team at SCAP for the past couple of years to strengthen environmental accounting in Fiji. Right now, Litia is involved in experimental land cover accounts, and this is also what Litia will be presenting on today. And Litia's interest is to really work to make use of SEER accounts for measuring SDG indicators and inform policy decisions. Litia, you have the floor, please.
Thank you, Rike. Just trying to share my screen. Can you see my screen? Are you able to see my screen? Yes.
We can see your screen. If Great. You can move to full presentation mode, please. Yes.
Is that fine now? Yes.
Wonderful. Please go ahead.
Okay, great. Good morning and afternoon and evening, everyone who's joining in. So this morning, my presentation is probably going to be a bit different from the other presenters that have gone before me. I'll be speaking on my experience of actually compiling during, before and during the COVID-19 and some of the things that I went through. Okay, just a brief overview of what I'll be speaking on. Just basically taking you through why we began compiling land accounts, how we have been progressing through the compilation of it, and then what we would like to improve on in the future. So basically, the Fiji Bureau of Statistics began working on SIA in 2016, and since then, the aim has always been to produce data that is not only timely and efficient, but also relevant and progressive. So one of the one of the ways of addressing this was to look at the data needs of policymakers, or at least try to anticipate the need that would arise by going through national documents and plans, looking at different national issues that were addressed in these documents. So one such document was the Green Growth Framework, which is a document that is included in our country's National Development Plan. And initially, what we wanted from land accounts was basically, we were after, because we had been studying TSA as well in my unit, we wanted to kind of join environment and tourism together. But we ended up having to produce a land cover account because that was a good base to start, and that was the data that we had available with us. And then in doing so, we looked at the Green Growth Framework and some of the issues that were brought up in the framework, and some of them are stated there. Basically, the big demand for land from different segments, the impacts of sea level rise on agriculture, and the impact of climate change on the land use activities. So in tackling the land cover account, we would be able to provide some data to help inform users on issues about, sustainable land and ocean resources that were addressed in the Green Growth Framework. So moving on to addressing SDGs, like linking land cover to SDGs was an advantage I thought was really useful in terms of reporting, not only at national level, but for reporting at global level, like by compiling land cover accounts and looking at a few of its aspects, like rate of change for forest cover, urban areas, and agricultural land area. This information can be used to help inform our reports on targets and goals for SDG, probably goal 15, where we look at, for example, indicator 5.1.1, forest areas as proportion to land area, or looking at goal 11, indicator 11.3.1, ratio of land consumption rate to population growth rate, or even goal 2, indicator 2.4.1, proportion of agricultural area under productive sustainable agriculture. So this account can either in part or fully help to measure some of these indicators, taking some of the pressure off those who have to report on these indicators every so often. That is like our colleagues in the Department of Environment, as well as the National Planning and Foreign Affairs offices. So this not only helps compilers like me appreciate more the robustness of SIA, but also helps users appreciate more the importance of data in our day-to-day activities. So in compiling land accounts, these were some of the stakeholders we came to appreciate in the process. Initially, when we started, we thought, okay, land accounts, so it makes sense to contact the lands department, which is true. But however, it wasn't until we were closely working with the lands department that we realized majority of the data is imputed by other ministries and organizations, as shown here. There are a myriad of stakeholders that contribute to the large data sets kept by the lands departments. So throughout this entire process of compiling these accounts, we have engaged forestry, Ministry of Forestry, agriculture, as well as lands. But this is only the beginning. Like, we're hoping to look at other departments as well, and the data that they're willing to share, as well as areas they would like us to share with them or help them with in terms of data and its management. After trying to get these land accounts off the ground for the past 3 years, and even before that with previous SIA accounts, I've really noticed that most departments work in silos, meaning they compile and use their own data without really going out to see if the data is already being compiled by someone else, and this adds to duplication and ineffectiveness. So really, I found the key thing was to communicate always and try and maintain professional relationships with other departments to improve data integration. Secondly, it was one thing to have the data available for use, but then came the question of whether the data is in a format that is compatible and consistent over time to allow for comparability, which was key for our experimental account. The initial goal was to compile a land cover matrix using maps that would be provided by the lands department with 2 specific points in time. They said they had the data, and when they provided it to us, our consultants and GIS expert Al-Had with Team SCAP, he immediately identified that we wouldn't be able to use the data because it was a combination of other years' data that was put into one. So, and just named specifically for that year. Apart from these, other challenges included the aggregation and disaggregation of data, meaning the land classes into relevant categories, keeping up with the demand for land data by policy planners and makers. And one of the challenges that was brought to my attention by our colleagues from the Lands Office was that extracting data from our land information system took time because many of the departments use different softwares. And so he was suggesting that we should try and have like a standard software that everyone can use. So moving forward, the approach that we took sort of a pragmatic approach since we did not have the locally sourced data that we initially wanted. Our consultants suggested that we use globally sourced data, which was available to the public via the European Space Agency website, ESA, as part of their climate change monitoring program initiative, I believe. So we used ESA maps, which was medium resolution for the period of 2000 to 2015. And we used QGIS software as this was open source and readily available and was also very cost saving and effective. For the analysis bit, we used the SEN method of regression, which I understand is more simple to compute, robust, and has limited assumptions regarding measurement errors. And we used the SEN template from the Finnish Meteorological Institute. I found it was quite user-friendly. So I'm really grateful for the SCAP team for sharing that template. Only a quarter of our consultation process was done face-to-face with Sohail present and Al-Had virtually connected. And I can confidently say that majority of the process for compiling this account was done through emails, messages, and calls. So both Sohail, Al-Had, and this SCAP team had been like holding my hand through this entire process via technology, which I thought was not only very cool, but effective and cost saving as well. So in a way, this was one of the good things that COVID brought out and pushing us out of our comfort zones and realizing alternative methods of compiling, and even validation of figures with other ministries was done virtually. So this is just like a brief summary in 10 steps of the process of training that I went through with Sohail and Al-Had, given the support from SCAP. And so it goes from how we compile the accounts, from downloading a software, extracting from Google databases, reading in the data, and processing it to generate the different land cover areas, to analysis using SEN template from the Finnish Meteorological Office. And then now up to the final stage of generating a land cover change matrix, after which I'll be putting it into report format, and then it'll be reviewed further and hopefully approved. So it's been a journey, to say the least, but one that I'm really thankful for. So the COVID-19 happened to expose more of the ineffectiveness of working in silos because of how the SDG indicators and goals are interconnected, and thus the importance of sharing information and data. So what I've learned during this pandemic in terms of data compilation is communication is key. Communication with consultants, communication with stakeholders, communication with data custodians. It was so critical from my end to constantly keep all the parties updated, with my progress, not only to keep track of each step, but also to keep the interest level and the momentum going. Otherwise, the compilation process would have completely halted. And this also goes hand in hand with perseverance at times. When I was unable to contact stakeholders during the pandemic, or even the consultants, but as soon as I was able to reestablish communication, I did so. Just tried to push on and try compiling the accounts, keep the momentum going. Technology also played an important role in facilitating everything, from communication via several apps and platforms such as this, Zoom and WhatsApp, to using QGIS for compilation without having to pay a big license fee for big programs and softwares that can meet my compilation needs. So I'm definitely grateful for the peer support that was given through Sohail Alahad and the SCAP team, which really propelled me to continue with this compilation even during lockdown. So thank you very much. And so just the way forward for us, working with line ministries through MOUs, I think is very important. Just because we don't have all the data, and we definitely need to work hand in hand with those who do, not only to help us in our reporting, but to also help them appreciate the data that they have and what it can be used for, and the different things that it can be used to inform. Encouraging data integration to leverage the appreciation of use of statistics. When we do data integration, there'll be more appreciation from ministries for the use of data. As well as the establishment of our NSDs. This will break down working in silos, I believe, and also the sense of building territories. Another key thing I feel is the documenting of this whole process, the trainings that I've done, and to ensure continuity regardless of who's compiling. And just training and capacity building for software such as R and QGIS, which are open source and readily available for the compilation of this account. Binaka Wakalevu. And if you have any questions, but for now I'll hand over back to Rike. Thanks, Rike.
Okay, thank you, Vinaka, Litia, and I will make sure that I also pass on your kind words to Alad and Sohail for the help they've provided along the process. So we just have a question coming in for you, Litia. This is from Sonia Herrera. She asks, did you also integrate alphanumeric data, and what type of other sources of data did you use?
So the main source of data that we used was just the public, the ESA1. That was our main underlying data, but we did get help from Ministry of Forestry, like they provided their data sets in terms of hectares for us to validate the land cover. And in terms of alphanumeric, I'm not too sure. I don't think so, but yeah.
Okay, well, I'll ask you one more question now, Litia, and then I'll make sure that that we direct the final questions in the session also to the other presenters. This question is from Ronald Jansen, one of our frequent question askers of this session. Ronald asks whether you encountered any problems with the resolution level that was available for the satellite data you used for mapping the land cover. Would higher resolution data have given different results?
Definitely, I think a higher resolution would have probably given us a higher confidence interval as well as better results. But from the validation that we got from the different ministries, like in our consultation process, the results were in line. So we didn't really face problems in that sense, but I would have definitely appreciated higher resolution data for sure.
Should I come in? And then I wanted to...
Thank you. And if I could just ask our other presenter, Ramiz, to mute. Very good. Thank you, Ramiz. Litia, thank you again. And thank you also for a presentation that shows that you at the Fiji Bureau of Statistics really practice what's preached in terms of looking at policy documents and programs to also provide direction for your statistical work. And I also believe that you did a very good practical illustration of what we heard from one of our first presenters, Luis, about the interagency collaboration necessary to take advantage of big data, and in particular for accounting, where we all know that this is a challenge all around. So thank you again, Litia. And it's now my pleasure to introduce the last speaker of this session. We've moved from Bangladesh eastwards to Fiji. We are now moving a little bit westwards again to New Zealand. And our next presenter is Richard Evans. Richard is the General Manager of Economic and Environment Insights at Statistics New Zealand. Richard was earlier at Statistics Canada as an expert in high-frequency economic indicators. And Richard is passionate about using data science and artificial intelligence to create user-centric data products from big data sources. Richard, we look forward to hearing your presentation. You have the floor, please.
Thank you very much, Rika. Can you hear me all right?
Yes, we can hear you fine.
And can you see my screen?
Not yet.
Not yet. Okay, let's have a look at that. Excuse me. Don't worry, I know what to do. We practice this.
Take your time, no worries. Here it's coming. Yes, Richard, there is a meeting alert on your screen. If you could just close that one. Very good. You are set to go. Please go ahead.
Great, thank you. Thank you, Ricky. Sorry about that. So it's a great pleasure to be here. I'm going to tell you about our little COVID adventure at Stats New Zealand and how it impacted our attempts at measuring well-being. So let me start with our Stats New Zealand well-being framework. We call it Indicators Aotearoa New Zealand. It consists of 6 pillars that you see illustrated here. They have social capability, economic self-determination, empowerment, and so on. What we aim to do, of course, and this is something that we're increasingly trying to embed across the policy space in this country, is to track as many aspects of well-being as possible. The vision is a carefully calibrated framework that would allow us, if there was, let's say, an industrial proposal to expand an industry, that the health impacts, environmental impacts, cultural impacts could all be factored in, and we end up with an equilibrium among all those different and sometimes competing aspects of well-being, and so as to maximize overall well-being and not neglect any one aspect of it. Now, COVID came along and threw us off our path. We heard a lot from that aspect of things from Yongyi earlier on, and it was true here as well. Web traffic at our IANS site, our well-being site, did not go up, and people were not very interested in that. And the reason was a new statistic was born. It did not exist before COVID. And I think it quickly became the most popular statistic in the world. You know, the man or woman in the street consulted it daily. It was a real-time statistic. It was available very frequently, daily usually, and in a very timely basis, same day or very next day. And of course, I'm speaking of the numbers of deceased, the numbers of infected, recovered, and so on. These are the figures for New Zealand. They are remarkably low by world standards, as you probably know. So what did this mean for our well-being framework and the other competing aspects? This is just one aspect of health. There was a lot of interest among our policy colleagues in New Zealand to understand what the economic impacts of the policy decisions that were being made to mitigate COVID. And here we immediately saw some of the weaknesses of our statistical system. I'm just showing a few of our numbers and how infrequently they're published and how long they take to come out. This was definitely not real-time data. What were our clients doing? Our policy clients were scrambling to find high-frequency data, and this is just a sampling of the monthly figures that they collected and were consulting frequently, and with their numbers of days after the month that they're released. Only one of them comes from Stats New Zealand, and that's the SNZ electronic card transactions. The others come from an assortment of banks, other ministries, and so on. So this caused, and of course we contributed to this. We started developing our own high frequency indicators. The first one we produced was one that gave a weekly snapshot of imports and exports to China, to and from China, and to and from the rest of the world. And we did this very quickly, and that was a tremendous success. That was a product we developed collaboratively with our central bank and finance colleagues. And this made us start to rethink quality. And there was a question earlier addressed to Yongyi about quality. And we had to remind ourselves that quality does not mean accuracy. Accuracy is just one part of quality, that there are other aspects to quality. There's also coherence, how the different statistics fit together, how quickly they come out, how often they come out. Are they findable? Are they accessible? And so on, and how detailed they are. And if we were rating our set of economic indicators, I think we would give high marks for their accuracy and their coherence, but low marks for timeliness and frequency and even accessibility and detail in the current context, certainly as they relate to COVID. So we set about coming up with as many indicators as possible, and a big part of our response was developing a COVID data portal. And this was a very different kind of web product, very different from the well-being product that I showed you at the beginning of this presentation. The bar to entry was low. It focused not entirely, but to a great degree on economic indicators. And we were ready to source them from wherever. So we did not place a high bar on accuracy. Before we host data, we normally like to vet the concepts and methods, publish papers on their quality and so on. That was all left aside. But what we got were some very useful indicators that solved the accessibility problem. Yeah. And so this allowed people to watch the crisis in near time. And here are just a couple of very quick examples. These were simple things like border crossings, and you can see them just dropping to near zero as the country was shut off from the rest of the world. Or here's something a bit more sophisticated. Natural language processing, which is a branch of machine learning used to estimate economic sentiment based on newsfeed data. And you see the dramatic drop in sentiment at the very end of the time series during our first and lengthiest period of lockdown, and then a recovery once lockdown was over, and then we're back in lockdown now, and so we can track the effects of lockdown on sentiment. It's once again visible. We have 2 weeks in a row of lower scores there at the very tail end of the series. So if we look at what we've done now and we take stock by returning to this quality framework of ours, the new indicators are low in accuracy, low in coherence, but very timely, very frequent, and readily accessible. Now, what more can we do? Well, all this new wealth of high frequency data and very timely data creates a new problem. There is complexity. There's no, as we said earlier, there's no coherence between them. How does one interpret what they mean in combination? So we had to access new and different methods to solve this problem. And we reached out to our colleagues at our Ministry of Finance, our Treasury, as we call it here, and those at our Reserve Bank, the central bank, and they brought their modeling skills to bear on the data that we had wrangled and brokered, and together we produced this this new indicator called the New Zealand Activity Index, which uses principal component analysis to tease out the co-movement from all these indicators. And as you can see, it tracks GDP remarkably well. And it's given the markets, it's given our policy colleagues something that gives them a sense of how deep GDP, the decline in GDP is likely to be, the month-by-month recovery, and so on. Of course, we've put it on our COVID portal, and it's there with all its component its input series as well. So that's highly convenient for our users. So I've moved the coherence ball a little bit to the right. It's not perfect, but we do have some synthesis, and we're making a little bit more sense, and we have a clear sense of the forest. And whereas before, with this richness of indicators, we were just looking at individual trees. Now, one may wonder, what about detail? Can more be done here? And this is where our some colleagues of ours who work in a separate team called Data Ventures have done some remarkable work acquiring high-frequency GPS data and high-frequency card spend. And so they can track people movements and their spending habits. And this is very much the realm of big data and big data engineering, pipelining. And this will be an exciting new front. These data have helped underpin the government's response, the National Crisis Management Center's response to the crisis by helping to model the spread of the disease and so on, and make decisions around lockdown, decisions that are data-based. So if we return to the beginning of this chat, we started with our well-being framework. I return to it now. We have been, with COVID, measuring one small part of health at high frequency, and that's the number of people infected and recovered and so on. And we've made a big push in the economic space with what I've just described to you. But the question arises, why wouldn't we do more? Why wouldn't we address the other pillars of our well-being framework? And of course, that is what we're going to try and do in the next little while. So what's next? On the economic pillar, we will expand our New Zealand activity index to make it regional, and so to get that synthetic view by the regions, and that will be particularly relevant as the government moves, as it already has, to regional lockdowns. So some regions are under lockdown while others are not. And so we'll be able to see the impact of that on economic activity. We plan to use more natural language processing and do more topic analysis on other themes like depression, suicide, education, and so on, to see if we can get a real-time view while we wait for the more accurate indicators to come out in the future. We want to make the COVID portal more well-being-like by loading these other thematic elements into it and diversifying it so it's less single-mindedly focused on the economic side of things. And finally, I want to just raise a question. Will we feel differently about what well-being is after COVID? When COVID is over, or even before it's over, have our definitions of well-being changed? Perhaps they have, and this is something that we will look at as well. So in conclusion, more real-time data bringing to light the trade-offs between COVID-related health and the other dimensions of well-being must be generated for our policy colleagues if they're to make informed choices around lockdowns and so on. And of course, big data pipelining and machine learning algorithms will play a big role in this, I am sure. In closing, I'll just mention that we haven't done much in this space, of machine learning and so on. I mentioned one instance of it. What we've been doing has been relatively simple because that's what people needed. And I heard that comment earlier, and I just want to reiterate it. It's very important to do what people need and not go around with a solution that's looking for a particular problem. So over to you, Rika. Thank you very much.
Thank you very much, Richard, for an excellent presentation. I believe that in some sense this COVID-19 crisis may have been just what statistical institutions needed to really change their game. I very much like the way you link things to the different dimensions of quality, because I think it's forced us all to start treating these different dimensions of quality with an equal weight, or adjusting their relative weight depending on where the immediate demand is for data. And I very much liked your philosophical question as well about well-being, but maybe we need another conference to really get around that one. Thanks again, Richard. We have now heard from all the speakers of this session, and we have just 2-3 minutes left for questions. So I will be asking just one follow-up question here, and that is a question that has come in for Ramiz. And so Ramiz, please listen up here. Now, the various hotspot maps you showed has triggered questions, and so one of them relates to the sub-district level and local governments. So could you say a little bit about how did local governments react to the information that was presented for them, and also what were the most important source of data in terms of helping out population and providing information at the sub-district level? Ramiz, please. You have just 1 minute here, please.
Yeah, it was really challenging when we started the discussion sharing data at the sub-district level with the civil servant, because they had to manage the number of patients and how to manage them, what is the information, what is the hospital preparation, and also the other administrative preparation. So what we were providing from central level, that was not helpful to them at all. They had to look at the very micro level data. Then they requested sub-district level data. Even at the very micro level, there is the village level data and also a bit ward level data, which is a bit larger than the village. So we had to create, based on the population data, based on the election data, we had to come up with some calculation and also with some mapping and also the COVID data. So with the population data and at the same time the household data and also the COVID data, we have to merge together and we have to come up with some analytics and mapping. In the beginning, it was huge challenging, but after June, we actually came up with some kind of very good analysis, and that was very helpful to the civil servant at the sub-district level. Thank you.
Thank you very much, Ramiz. And I'm just using my prerogative here as a moderator to squeeze one more follow-up question in. It's come in to you, Richard, and it's from Ivan Snow, the chief statistician of Suriname. And he says, well, relevance is a very important dimension of quality. COVID-19 is very relevant now, but so is employment, unemployment, GDP. So Richard, how do you prioritize?
It's quite simple. You talk to your most important clients and you find out what it is they would like you to do. And so this crisis has been an opportunity to get to know these people better. They're very interested in data more than ever before. And so I think that's my short answer. No doubt we have spun up some things. We will be spinning some down after this crisis. And yeah, I don't think all these things we're doing are going to last forever. Some of them will be curtailed after the crisis. Thank you.
Okay, thank you, Richard, for very succinct answer to a very big question. I think but in summary here, it's the client is the master. Yeah, so maybe we all need to get into stakeholder analysis in detail here, and with that, I close the session. It's just been an hour and a half, and I want to thank all of you for your excellent inputs during this session. There is lots of food for thought, and I think materials enough to extend this into a much longer dialogue. But I do hope our live audience has enjoyed and will also take the opportunity to continue to engage through the live stream chat and enjoy also the rest of this international conference. So it's been my pleasure to moderate today. Finally, an announcement from the organizers, and that is that there will now be a 10 minutes break to give everyone time to set up the next session, session five, which will then start in 10 minutes. So thank you very much. And good day, good evening to everyone. Thanks.
Thank you very much.
Thank you. Bye-bye.
Okay, thanks.